pass over to Jeremy Kenner from the NHMRC, and he's going to be discussing changes to the National Statement, Chapter 4. Thank you, Jeremy.
Thank you, Fiona, and thank you, Gordon, and all the other organizers for the opportunity to talk to everyone today. I want to, however, submit a complaint that I'm the first one to be asked to follow Ian, and that's really not fair. Of course, the subject matter of what I'm presenting is rather more pedestrian than what Ian presented, but then there's always a place for prose as well as poetry. And we didn't, by the way, coordinate our facial hair, although it might seem as though we did. And that's the humor segment for the talk. I'm here to present an update on the NHMRC review of the National Statement. In this case, Section 4. Section 5, for those of you who've studied the program intimately, is on Friday, tucked into an afternoon session at 3 o'clock, in case you want to know what we're doing there. To the content of today's presentation. I'll just flip through the first few slides fairly quickly. For those of you who aren't aware, of course, the National Statement on Ethical Conduct in Human Research is Australia's principal guideline for this, and it sets out various requirements for ethical design, review, and conduct of human research. Importantly, it's limited to human research, and so there are issues that always arise regarding what to do about things that aren't human research, such as quality improvement or registries or research infrastructure, things like that. It's, of course, a principles-based, it's a mixture of high-level guidance.
Sorry, I beg your pardon, Jeremy. Are you
Yeah.
going to be showing some slides?
Oh, aren't they showing?
No, you'll need to share your screen. Yes.
Sorry, I was asked not to, and then I forgot to redo it.
Yes, thank you.
How's that? Can you see?
Yes, thank you.
Right. Okay. Well, this was the first slide, except for the introductory one. My apologies. So the main areas covered in the National Statement are, it's organized into a few sections. For those of you who may or may not know, the National Statement is quite unique in terms of international ethics guidance documents. It's nothing like the Canadian document, which is much more narrative form. In the United States, it's much more reliant upon regulations set out in a code of federal regulations. We're so unique, and we've limited it to these sections and risk to benefit and consent. You can read the slide. The various sections involved. One we're focused on today is currently called ethical considerations specific to participants. And this is the first time that I'll note that it actually does not mention in a prominent way vulnerability. The current National Statement does not refer to vulnerable groups. It was never meant to be taken as a section related to vulnerable groups. However, that is the way many people use it and think about it. And so much of what we've tried to do has been to address that common usage. So we've made updates over time to the National Statement and its predecessors. There were statements on human experimentation as far back as 1966, which was a paragraph, 76, 82, 92, and then the full National Statement as you know it is the 1999 version. And then the 2007 version was done as a product of 2 or 3 year review, and it is co-authored by the NHMRC, the Australian Research Council, and Universities Australia. It then remained pretty stable for a while, although we had opened it up to the idea of changes as changes were necessary, what we called rolling review at the time. And ultimately, we made some updates in 2014 to a few of the chapters. And then we did a full review of Section 3, one of the 5 sections, leading up to a publication in 2018. And we then turned our eyes to Sections 4 and 5, which were the next up in a user survey that we did back in 2014 to find out what we should do next. So in the current review addresses Sections 4 and 5, which the contents of which are displayed on the screen. And the stages in that review process were that we would establish separate committees for the review of sections 4 and 5. We redrafted each section, which took quite a lot of time. We undertook public consultations from August to October of last year, and 117 of you made submissions. I'm hoping all 117 submitters are online today. We analyzed each submission and redrafted the text, in this case for section 4, including some work on the fundamental structure per the input that we received as part of consultation, for which there was a lot of input, both favorably and unfavorably. So the plan is to undertake another targeted consultation on a series really of targeted consultations of various elements of section 4 early next year, and then undertake public consultation on section 5 also early next year, because we've completed that work in preparation for that consultation. And then we'll follow that with public consultation on section 4 later in 2022, based on the outcome of the targeted consultations that we conducted early in the year. And this would be a place to insert a sort of explanation, if not an apology, for how long it's taking. We can use the COVID excuse, and we will, but it also has to do with a number of issues, such as the complexity of the feedback that we received, and the fact that principal committees of the NHMRC in the new triennium, which began July 1st, have yet to be appointed, and therefore we are a little bit hamstrung in how fast we can get things out the door. So the review of section 4 as part of the 2020 consultation, what we tried to do there was we tried to rethink vulnerability, or think about it in a comprehensive sort of a way. And rather than listing a bunch of groups that may or may not be vulnerable at one time or another, either individually or collectively, we wanted to focus on what the sources of vulnerability were. And one of them being the nature, the design, and the context of the research itself, not necessarily just the characteristics or circumstances of participants in research. And then the interactions between those two and how they may create vulnerabilities that wouldn't otherwise be present. And I'll get back to this in a little bit. Our intention was to better characterize vulnerability as, and these are fancier words, contingent, variable, multifactorial, and everybody's favorite, intersectional, rather than as immutable individual characteristics or functions of group identity. We wanted to highlight the impact of an individual stage of life and their life circumstances on their experience of vulnerability when participating in research. And this is critical because we think of vulnerability in research as really focused on the research. People may not be vulnerable in other aspects of their lives, but they may be vulnerable in a particular way because of their participation in research. And this is not, this also partly recognizes that vulnerability can arise from the research context itself, rather than being understood exclusively as a property of the participant. And one of the points here, of course, is that we are all vulnerable in various ways at various times, but we can't all be considered needing special consideration under the national statement for when we're participating in research, and trying to untie those things is quite complex. We also tried to remove what was really an automatic link between potential vulnerability, as people saw it, or membership in a particular group, and the level of ethics review that was required. So if you recall, there's a list essentially at the front of, as part of the chapters in section 4, as well as part of the beginning of chapter 5.1 in section 5, which basically says, if you're part of this group or it's this kind of research, HREC review is required. We wanted to break that link. When we reviewed section 3, we did that for interventional, or what you people like to call clinical trial research, and for genomic research, while recognizing that most of that research would necessitate HREC review. It didn't definitionally require that, and could, in certain circumstances, a low-risk review process could be applied. Same here, wanted to do for population groups, vulnerable groups, however people leave them. We also were proposing to relocate some of the guidance on Aboriginal, or all of the guidance on Aboriginal and Torres Strait Islander research, to the front of the national statement, with stronger links to more detailed documents, such as our Indigenous Research Ethics Guidelines, of which there are 2, and the new AATSIS Code of Ethics, because that's where most of the detail that someone would need to conduct research of this sort, that's where it would be found. So to try and repeat it in the national statement in a sort of summary form seemed problematic. We also wanted to introduce new guidance for research conducted during natural disasters, armed conflict, public health crises, or other emergencies, which, as we know, has no pertinence whatsoever to our current circumstances. So when we got our feedback, we got a lot of people who said, look, we kind of like what you were trying to do, but we don't really like the way you did it. And one of the things we didn't like was that we didn't like the fact that you just removed chapters devoted to particular population groups, because that's what we rely on, not really in a tick box fashion, but in a sort of just a structural fashion in order to review and design our research and take account of the guidance that's required for special consideration for various groups. So our challenge is how to reconcile researchers and reviewers' desire for clear identification of groups that do require special consideration without reinforcing the blanket labeling of those groups as vulnerable populations. You can see it's a tricky thing to do, but very worthy of our attention. So what we might do, and what we're currently trying to do, is to shift the focus a little bit towards risk of harm and burden and the need for special consideration, rather than on the use of vulnerability as the organizational principle. Although there will, of course, be substantial mention of the concept of vulnerability and its various permutations throughout the text. We were intending at this point to reintroduce traditional chapters focused on participant groups, but also on research contexts, and to use reduced and simplified introductory language, because one of the main criticisms was this is a great academic essay, but it's not helpful. This is the national statement. We need it to be practical, and we've taken that input under advice. So the focused targeted consultations to which I referred will be first and foremost with the Aboriginal and Torres Strait Islander research community and various stakeholders there, who are somewhat split on whether our approach works or doesn't work, and they have some alternatives that they have proposed, and we'll be working with those individuals and organizations to try and find a consensus sort of approach to it. We'll also be focusing some of our a consultation on research involving children and young people. Most people were fairly happy with what we did, but the main tension there is that there's concern that the way that we've done things doesn't line up with some of the legal frameworks that people rely on, and the very difficult interplay between consent as an ethics concept and as a legal concept, particularly when it involves children and young people. We'll also be doing some consultation regarding research involving people living with disabilities, and people who lack the capacity to provide consent in all the many forms that takes, as well as some work probably more technical in the fetal research area. You'll note that one of the things that we did in the national statement was remove pregnant women as a named group, for reasons that I won't go into, but would seem obvious. And we anticipate that we'll conduct, as I said, a public consultation on the revised draft of Section 4 in late 2022. I think, although I'm probably a couple of minutes under, I'll stop there, and hopefully folks will have some questions at the end. Thank you very much.